I'm with Fadi El Jardali, Associate Professor at the American University of Beirut. Hello.
Hello.
What are you discussing this year at the World Healthcare Congress Middle East?
Well, this morning we have a keynote panel where we discussed the role of evidence in making better decisions. So I talked about the role of policymakers in making better use of evidence when they make decisions. So how they strengthen the evidence-informed policy-making process inside policy-making institutions and countries.
Mm-hmm. And why do you think such an event is very important?
Well, it's very important because I think in the region there has been a lot of over the last many years there has been a wave of reform efforts towards improving health systems. There has been a mix of successes and failures in many countries. I think it's important where countries start to share knowledge about what works well and why, and what the things that really don't work well and why not. But also it's important in this year as well to start to raise the awareness about how governments, how health system can actually tap more into existing knowledge, information, and evidence, and try to use them in making better decisions.
Mm-hmm. What are some of the things your organization is doing to face healthcare challenges?
Well, we have been working. I work at an academic institution at the American University of Beirut, so we very much work with policymakers and other researchers in order to provide and generate policy-relevant research evidence. We work with policymakers to identify what are really their policy priorities, what are their concerns, and we try as much as we can to actually align our research production, the production of evidence to make better linkages with their policy concerns, and to help answer some of their pressing policy questions.
Mm-hmm. And what do you think can be done to make health system reform more successful?
Well, one of the things I think we need to also take into consideration that we need a different way of thinking about health reform. We need to integrate the system thinking concept and approach to addressing problems. Many of the public health problem is not rooted only in the health field. There are many fields outside, or many areas outside the health that actually can impact into the health status of the population. So the question is really how we can integrate health in all public policies, not only in health policies. How we can actually, the second important thing about reform, if we need to make it much more effective and successful, is in fact to try to in a way encourage the problem-solving approach, or the collective problem-solving approach to things. So how we can really have policymakers, stakeholders, researchers, and other players around the table talking about a particular problem, because most of the health system problems are complex, require the intervention of many stakeholders in a collective manner. So what I would like to see more is really more appreciation for the collective problem-solving approach, more openness a little bit in terms of recognizing the problems, but giving a little bit more time to analyzing the problem, the policy problems. I would like to see more appreciation for the role of evidence in making decisions. I would like to see more also some appreciation or at least some openness to looking at different policy options to address a particular problem, in addition to their implementation barriers and implementation strategies. So we need a little bit a different way of making decisions in order to make health reform more effective. Again, collective problem-solving approach, system thinking approach, engagement of different stakeholders within the government and outside the government, including private sector, civil society groups, academia, researchers, and other stakeholders, to all work together in terms of a collective manner in order to address pressing health system challenges.
Not just in your home country, but in the Middle East.
In the whole Middle East.
And governments together as well.
Absolutely.
All right, Fadi El Jardali, thank you so much.
Thank you so much.
It was a pleasure having you here at the World Healthcare Congress in the Middle East.
Thank you so much.
Shukran.
Thanks. Appreciate it.